Understanding pharmacokinetics and the distribution of medication in the bloodstream, the PHMNP monitors which of the following patients for possible toxicity and a need for lowered dosing.
Letter A. A malnourished patient. Letter B. A patient with Crohn's disease. Letter C. A 20-year-old patient with high fever. Letter D. An athletic patient. Answer is Letter A. Malnourished patient. The principle of distribution requires that the medication binds to a protein for movement through the body. When person is malnourished, they may be protein deficient and have less protein for the medications to bind. This leaves more active medication in the bloodstream and increases of toxicity.
All of the following are cluster B personality disorders except letter A, histrionic, letter B, narcissistic, letter C, obsessive-compulsive, letter D, antisocial. Answer is letter C, obsessive-compulsive. Cluster A patients are characterized as withdrawn, cold, suspicious and irrational. Cluster A inquides paranoid, schizoid and schizotype PAL personality disorder. Paranoid shown in the picture that shows pair and nude to recall sketch droid WHO likes to play solitaire, not interested on the outside world. Schizotype PAL are usually socially awkward. Cluster B patients are characterized as theatrical, emotional and attention-seeking. Cluster B includes antisocial, borderline, histrionic, and narcissistic personality disorders. Anti-personality disorder exhibit criminal behavior beginning in childhood such as truancy, fighting, destructiveness and theft. They show no remorse for their behavior. Borderline personality disorder exhibit impulsivity, self-harm, inappropriate anger, and affective instability. Histrionic personality disorder. They appear overly emotional, vague and desperate for attention. They demand constant reassurance about their attractiveness. Narcissistic personality disorder. ACT self-important or preoccupied with envy, fantasy of success and ruminations. They reject criticism and need constant admiration from others. Cluster C patient tend to be anxious, fearful. Cluster C includes avoidant, dependent, and obsessive-compulsive personality disorders. All of the following words describe a cluster B personality disorder except letter A, emotional, letter B, theatrical, letter C, over-controlled, letter D, attention-seeking. All of the following words describe a cluster B personality disorder except letter A, emotional, letter B, theatrical, letter C, over-controlled, letter D, attention-seeking. Answer is letter C, over-controlled. It is more accurately describes cluster C personality disorders. Answer is letter C, over-controlled. It is more accurately describes cluster C personality disorders. In which of the following situations would a risk assessment be used as opposed to a forensic risk assessment? Letter A for patients with a mental health diagnosis and violent history. Letter B before the release of an incarcerated patient with a mental health diagnosis. Letter C for patients with mental health diagnosis and a criminal background. Letter D following an arrest and before confinement to a correctional facility. Answer is letter D, following an arrest and before confinement to a correctional facility. A risk assessment is completed in an emergency department after arrest and before confinement. You are a new nurse practitioner opening your own solo practice. You understand that you are expected to be competent in your role of treating and diagnosing patients. As a nurse practitioner, you are expected to be competent in all of the following core competency areas except letter A, policy, letter B, practice inquiry, letter C, technology and information, letter D, ICD-9 and ICD-10 code memorization. Correct answer is D. Although NP are expected to know these diagnostic codes, it is not expected that they memorize them. but rather that they use up-to-date resources for accuracy in diagnosis coding.